Within a few days, you may see and feel a firm line running beneath the incision, and that's the healing ridge. It's a good sign. Your body is knitting the deeper layers together. Are you ready to get back to what you love after knee replacement? The Total Knee Success Podcast is your trusted guide with practical tips, evidence-based strategies, and no fluff. It's not personal medical advice, just solid education to help you manage pain, regain mobility, and get back to living the life you love. Welcome back to the Total Knee Success Podcast. I'm Michelle, and today we're focusing on something everyone sees after surgery. That's the incision. After a total knee replacement, most people have a vertical incision that runs down the front of the knee. Maybe you think of it as your battle stripe, and yes, even your bionic knee gets one. A mark of this new beginning, strength, and healing. How your incision heals affects more than how it looks. It influences how comfortable your knee feels, how sensitive the surrounding skin is, and how smoothly you can bend and move. By the end of this episode, you'll know what's typical in healing, what changes deserve attention, and how to care for your skin so it stays flexible and healthy. Most incisions after total knee heal very well when you keep them clean, follow your surgeon's directions, and monitor for early warning signs. In fact, only about 5 to 10% of patients experience moderate incision site challenges, such as delayed closure, persistent redness, or superficial drainage, in the early weeks. Let's talk about what's happening beneath the surface as your body goes to work. One of the main players in healing is collagen, a strong, rope-like protein that forms the scaffolding of new skin and gives it both strength and flexibility. Right after surgery, your body gets to work building new granulation tissue, a healthy red layer filled with tiny blood vessels and early collagen fibers. Within a few days, you may see and feel a firm line running beneath the incision, and that's the healing ridge. It's a good sign. Your body is knitting the deeper layers together. The ridge usually softens gradually over several weeks. You may also notice a small patch of numbness next to the scar, and this happens because tiny sensory nerves, especially the infrapatellar branch of the saphenous nerve, are often cut or divided during surgery. It doesn't affect your knee's strength or movement. In many studies, the area of numbness is reported in roughly 25 to 30% of patients when asked subjectively, though objective nerve changes may reach 80 to 100%. Over time, these nerves can regenerate, and studies show that the numb area typically shrinks by about 40% during the first year after surgery. In the early weeks, the incision may look pink or slightly raised, and that's collagen production at work. It often feels tight or itchy, which is normal too, as the tissue remodels. During this period, keep the incision clean and allow gentle shower water to run over it. Research supports early showering with clean running water after total joint surgery once the dressing is removed. Check with your surgeon and check with your postoperative instructions for details on what you should be doing. Don't soak the knee in a bath, pool, or hot tub until your surgeon confirms it's fully closed. Protect the incision from direct sun and abrasive clothing. You'll want to use a broad-spectrum sunscreen and cover the area if you're out in the sun, especially since scar tissue remains vulnerable for up to 12 months. A small amount of clear or light pink drainage on the original hospital dressing is normal during the first day or two. After that, the dressing should stay mostly dry. If you notice new fluid after several dry days, especially yellow, green, cloudy, or even foul-smelling drainage, contact your surgeon. When we say foul, we mean an odor that's sour, musty, or like spoiled food, not the mild, clean scent of healthy skin. A mild rash near the dressing isn't rare. Studies estimate that 5 to 10% of patients experience a mild adhesive or antiseptic reaction that resolves once the dressing is changed or hypoallergenic tape is used. If it spreads, blisters, or is accompanied by drainage or fever, that's something your surgeon should take a look at. Occasionally, an incision can begin to separate, a condition called dehiscence. It can appear as a small gap where the edges no longer meet. If this happens, pause your exercises and reach out to your surgeon without delay. You might also hear the term slough. That's a soft, yellowish tissue that can form when a wound isn't healing properly. That's not normal after surgery, and it's something your surgeon should take a look at. Because the layers under the skin are still fragile early on, forcing deep bending too soon can put too much tension on the incision, potentially causing tissue strain or delaying healing. Closure techniques have advanced quite a bit. In the past, staples or large sutures were standard, and today many surgeons use absorbable sutures under the skin and seal the surface with 2-octyl cyanoacrylate, a medical-grade skin adhesive that forms a thin, waterproof film. Brand names you might have heard include Dermabond, Surgiseal, Liquiband Exceed, and Octyl-Seal. This method lets you shower sooner and often eliminates the need for surface stitch removal. Some surgeons still use staples or nylon sutures, particularly in revision or high-tension cases, and that simply means situations where the skin edges are under more stretch or pressure because of swelling, larger incisions, or limited soft tissue mobility. Large meta-analyses show that when applied correctly, all methods achieve comparable infection and healing rates. For people with higher BMI, diabetes, or increased swelling, surgeons may also use incisional negative pressure therapy, sometimes called a closed incision wound vac, or CINPT. This small suction dressing gently removes excess fluid, lowers stress on the incision, and helps maintain a stable healing environment. Systematic reviews show it can reduce postoperative wound complications and deep infections in higher risk groups. Once your incision is fully closed, you can begin scar care. Make sure your surgeon or therapist clears you first. Start by washing your hands, gently cleaning the area, and applying a fragrance-free lotion or, if you choose, a medical-grade silicone gel. Then massage across and around the scar with light circular motions, maybe side to side, up and down, even small figure eights, for about 3 to 5 minutes once or twice daily. Research supports silicone gels and sheets as an effective optional tool for reducing redness and thickness in raised scars, though they're not required for a healthy result. When choosing skin products, stick with gentle, non-fragranced options and avoid strong active ingredients until your incision is mature. A silicone-based product remains optional, but helpful for some. I'll put links to a couple of the more popular products in the show notes. Let me share a quick story that illustrates how small adjustments can make a big difference. I once worked with someone who developed petechiae, and that's tiny red or purple dots caused by small blood vessels rupturing beneath the skin. He had these on his lower leg after surgery. It turned out he was wearing his intermittent compression devices constantly, even while walking around his home, and he had turned them up way too high. That continuous pressure caused the capillaries to rupture, producing the petechiae. Once he used the devices as directed, the problem resolved. So remember, you're still in the driver's seat of your healing. Use your therapist's guidance and your surgeon's plan as a roadmap. And if something looks off or feels strange, don't hesitate to ask questions. This is also a great reason to keep attending therapy. Your therapist helps spot and prevent issues before they become bigger problems. Now, let's shift gears for a moment. You might be wondering whether taking collagen supplements could help your skin or incision heal faster. Collagen is the same structural protein your body produces naturally to give strength and elasticity to skin and connective tissue. Some studies suggest that hydrolyzed collagen or collagen peptides may improve skin hydration and elasticity and could modestly support wound healing. For instance, a 2023 systematic review of 26 randomized controlled trials found significant improvements in skin elasticity and hydration with oral collagen. A 2021 review reported similar modest benefits with doses between 2.5 and 10 grams daily. At this point, no strong evidence links oral collagen directly to faster surgical scar maturation, but it appears to be safe for most adults. If you're interested, discuss it with your healthcare provider to ensure it fits safely in your overall plan. I'll put links to a couple of the more popular collagen products in the show notes and on the website at totalkneesuccess.com if you'd like to take a look. If you ever notice spreading redness, new drainage, a gap in the incision, odor, fever, chills, or a scar that becomes painful or significantly limits motion, call your surgeon. Early action almost always leads to better outcomes. To summarize, the healing ridge you feel is your body building new collagen, a positive sign. A little clear drainage early is fine. New or smelly drainage is not. Keep the area clean, don't soak it till cleared. Avoid direct sun exposure for up to a year. And follow your early bending limits to avoid stressing the incision. When cleared, gentle massage and simple skin care keep the tissue soft and mobile. You're healing one day at a time. Stay patient, keep talking with your team, and give your new knee the consistent care it deserves. I'll see you next time in episode 17, where we'll talk about driving after knee replacement, what the research says about reaction time, and when it's safe to get back behind the wheel. This podcast is for educational purposes only. Discover more at totalkneesuccess.com, and be sure to subscribe and share, because every step forward takes you closer to living the life you love.